What we have here is we have a needle positioned in the right C5-6 facet joint. This here is a contrast agent. Looks clear in the syringe, but on the x-ray it actually looks dark. And I see the contrast material filling the facet joint, so I know I'm in the right spot. At this point, we inject some PRP. To make the experience a little bit better, I'm going to put a little numbing medication at this spot. I don't want to put too much, just because the facet joint will only hold a certain amount of volume, and I want most of that volume to be my PRP solution. So now we're going to put some PRP solution in there until I feel a bit of resistance, and that means that that's about as much as the joint is going to hold. I now back the needle out a little bit, put a little more PRP, because I want to surround that facet capsule from both the inside as well as the outside. And so that's it for that joint. We've already treated the joint below, which is the C6-7 joint. I've now treated the C5-6, and I'm going to redirect my needle and treat the C4-5 joint, and that'll complete the treatment on the right side. And we're taking intermittent x-ray pictures to make sure that the needle is in fact going in the correct direction. We were a little low there, so I made a slight adjustment. Now I'm headed right at that joint. How we doing?
Good.
Constantly checking in with our patient to make sure that we're doing all right. As you can see, it's a well-tolerated procedure, and this is all done with no anesthesia. We just are using a local anesthesia to numb the skin, and the entire process is very well tolerated. So we're in that joint now. We're going to go back to our contrast agent, and I also don't want to put a whole lot of that in to make sure that we're in the right spot, but I don't want to fill too much of the joint with that solution. Okay, I'm going to give him just a little bit of numbing medication here, and then some more PRP. And again, pull out and get some more along the joint. Now we're going to repeat the same process on the left side, and I'm also going to treat the ligaments in the center of the spine that are between the bones to add even more stability to the neck, and we'll follow that then with physical therapy, and we should start seeing nice results in several weeks. Thanks.